Right. So I think last week, certainly in a couple of venues, I've mentioned that I've put the odds of a significant outbreak of BA2 or current variants as about a coin toss in the US. So wanted to go into a little more detail about what's going on there and potentially what we can expect and just some general trends that I think people should be aware of. So first of all, just to check in on South Africa, which we've been keeping track of since the rise of their fifth epidemic wave, as you can see here, driven by BA4-5 that we'll talk about. They currently are still seeing increasing case counts, although certainly not near the magnitude of the original BA1 Omicron wave that they saw in late December or in late November and December, but they're certainly approaching the magnitude of previous outbreaks in terms of case counts. What is good is so far hospitalizations don't seem to be approaching those levels yet, and that can be potentially explained by a number of things. First of all, South Africa has been increasing its vaccination rates significantly, and that was accelerated by the BA1 outbreak. They've also had multiple waves of infection with very high incidence within the country. So most people in South Africa have been infected at least once, if not more than once, and many have now been vaccinated. So they do have better background immunity, I think, than many. So we'll wait and see what coming weeks show regarding those data, but that's certainly encouraging, at least there. What we know about variants in South Africa, and this is a bit of a complicated slide, but I think it shows a couple of things. So if you look at those colored dots and lines, those lines are the averaged curves of these variant prevalence over the history of the pandemic. And you can see that now the two arrows, the red and the orange arrow, point to BA4 and 5, which now essentially form 100% of the variants that are occurring in South Africa. They're about split even 50-50 between BA4, 5, as you can see there. But I think one phenomenon to note is the increasing frequency with which new variants are arising in South Africa. So if you can kind of extrapolate there between the first wave of beta that occurred back in February of 2020, and then look at actually it's 2021, and then look at then the subsequent rise of Delta that occurred in September. That's about a 9-month window or so, 8-month window. Prior to beta arising, it was a year, essentially 12 months from the original version of the virus that circulated in South Africa. Then you look from Delta to BA1, that was a shorter period of time of about 4 months. BA1 to BA2 was only 2 months. And now 2 months or a little less from BA2 to BA4 and 5. So what you're seeing, at least in South Africa, is kind of this increasing frequency of significant rise in new variants. And I think we're seeing that in other places across the world as more vaccine immunity and more infection immunity is creating the environment to drive the virus in new directions and to drive it more quickly. So doesn't seem that the rise of new variants is slowing down, as you can see. In fact, it's accelerating. And so far, I don't think there's anything that indicates we're going to see a change in that in the near future. Speaking of that, in the US, we're seeing the rise of a different new variant, and it's not BA4 and 5 that seem to be driving some of the recent activity that we're seeing in the eastern part of the US. It's this new variant, BA212 and BA212.1, which seems to be potentially even more transmissible. That was first discovered in New York in the mid-Atlantic states and seems to be, again, increasing in prevalence overall across the US. And that arrow shows you what, the current or the most current data on BA 2.12.1 is that we have. And you can see it's around at least 30% of the current variants. And again, these data are about 10 days to 14 days old, just based on sequencing. So if that trend continues, we're well above that now. So that seems to be replacing BA2. And so far, we haven't seen a significant prevalence of BA4-5 yet in the US, although certainly those variants have been detected. So that's the race right now in the US. But what we're seeing is significant increase in cases. On the left there, that's from today's New York Times, showing the daily case incidence. And as you can see, we're back at levels similar to where we were between the Delta wave and the BA1 Omicron wave, and we're going up. And in terms of case incidence, that's higher, significantly higher than we were last summer. And so we're going to set a baseline again that's much higher than the summer baseline we had last year. And that's at a best case scenario. Worst case scenario is this curve continues to go up and we do see a significant wave. We're also seeing, as you can see, an upturn in hospitalizations and deaths. We did not drop down to the levels below where we saw last summer. And again, we're back on the way up. And on the right, I'll just point out that we are the outlier among developed countries in terms of our boosting rate. As you can see, we're still only hovering about 30% of the population has received a third vaccine dose or booster dose, as it's being called, and certainly even fewer have received a fourth dose of the of those over 50 and with immune compromising conditions who are eligible. So we are much, much more vulnerable than most of these other countries, than all of these other countries in terms of our susceptibility to transmission and hospitalization and death. And you can see in terms of deaths, we're approaching the 1 million mark, at least based on CDC and New York Times data. Some other sources, as you've probably seen, including NBC and others, have already had us surpassing the 1 million mark. And clearly in true deaths, we've long ago passed 1 million. If you look at a heat map of where things are warming up in the US, and I will caveat this, if you have remembered any of the maps that I've shown from COVID Act Now in the past, they've looked a lot more red and orange and yellow, but this is based on the new CDC risk stratification. So it looks a lot better just at baseline. But to be clear, a couple of weeks ago, this map was just essentially entirely green. And now we've seen significant changes, and you can see particularly in the Northeast. And it's been more spotty here than in what we've seen previously. Certainly seems to be more concentrated in urban areas. If you look in Michigan, it's mostly around the Detroit metro area. If you look in Florida, it's around Tampa and Miami. If you look in Virginia and Maryland, it's around the DC area. So we're seeing spots, especially centered around urban areas, and then really just about all of New England is hot, and much of the mid-Atlantic, including New York. When you start to delve down into this, it gets a little more concerning when you think about many of these states, especially in New England, that have done well and did relatively well in terms of getting people vaccinated early and getting boosters out, but in terms of getting fourth doses of vaccine into people, we're not doing as well in boosters now. We are a long way out for many people, well over 6 months to 8 months for many folks who got boosters. And so what we're seeing in terms of case counts is, if you take away the Omicron wave, which was just so disproportionately larger than any other, and think about where New Hampshire is, outside of Omicron, this is the second worst wave of COVID-19 that they've had in terms of case counts, right? The only thing worse was back in December 2020 and January 2021, and then obviously the Omicron wave surpassed that. But this is at least the third worst wave in terms of cases that they've seen in New Hampshire. And again, the second worst other than Omicron. And that's also bearing out in hospitalizations. Now, again, New Hampshire's done pretty well overall in hospitalizations. If you were to normalize this to population, much better than many other states, including ours. However, it is, I think, important to realize that in terms of hospitalizations, there's been a dramatic rise in hospitalizations over the last month, and now they are essentially approaching the third worst wave in terms of hospitalizations in New Hampshire. In Maine, this is also similarly true. As you can see, this is now the second worst wave in terms of cases in in Maine that they've seen since the beginning of the pandemic in terms of number of cases. Now, these are normalized, or these are reported now on a weekly basis to conform with the CDC guidance. So as you can see, 41 cases per week would roughly equal 60 cases, right, per day. So 60 cases per 100,000, still well below peaks that we've seen and other states have seen, which many peaked above 200. Nevertheless, for Maine, relatively speaking, this is a really bad outbreak. And again, the second worst that they've seen since the pandemic started. And that's also true in terms of hospitalizations. You can see they're rapidly approaching the second worst wave in hospitalizations that occurred in late 2020, early 2021. And on this pace, they will eclipse that pretty soon over the next week. And so it's not just cases in these states that are seeing significant rise. They're also seeing a significant rise in hospitalizations, especially relative for them. Vermont, same thing, second worst wave they've seen in number of cases, and second worst wave they've seen in number of hospitalizations now. So they are seeing dramatic increases in COVID activity. New York, similar. This is now, in terms of cases, approaching the third worst that they've seen. You can see almost eclipsing what they saw in March and April of 2020. Now, in real terms, that's not the case because testing was so much more limited then. That true case counts were much higher. And so they're probably not at that level, but just again, for point of reference, officially counted cases, this is now the third worst wave they've seen. And they're seeing significant increases in hospitalizations as well, above their Delta wave or close to their Delta wave. And for some counties in New York, it's much higher, and we'll show that in a minute. So New Jersey, same thing, again, much higher than they've seen other than Omicron since January of 2021. And in terms of hospitalizations, thankfully, New Jersey hasn't had as much of a movement as other states. But again, keep in mind, these things are relative for these states, and also these states are have much higher vaccination and much higher boosting rates than much of the Midwest and South. Now, when you look at specific counties, it becomes even more pronounced in some places. This is Erie County, which includes Buffalo, New York, and you can see now in terms of cases, the second worst wave that Buffalo has experienced, other than Omicron in terms of cases. And again, approaching, what they saw, certainly eclipsed what they saw during Delta, approaching what they saw during that little blip in May of last year, which was an alpha wave. As you remember, around the Great Lakes, there were a number of places that had a significant wave of alpha infections that caused hospitalizations, but this is approaching that. And so I don't think you're picking it up in the media, certainly, unless you read the coverage closely. But for many areas of the Northeast, this is one of the worst waves of COVID that they've experienced. And I think that the fact that that's the case, even in a highly vaccinated population, again, highlights the importance of being up to date on vaccines and having recent doses of vaccine, which are the most important predictors. And it also highlights that these viruses, these new variants we're dealing with, are not necessarily as inherently more mild as people tend to think. And in fact, this paper just came out a couple of days ago that seems to emphasize this point. So this is by folks out of Mass General and Harvard who looked at electronic health record data and state vaccination data in Massachusetts for a large healthcare system. And given that these folks are from Mass General, you can guess which large healthcare system in Massachusetts that is. And they did a weighted case controlled study of 130,000 COVID patients, adjusting for confounders such as age, sex, how sick these people were at baseline. So what underlying comorbidities did they have? And then what was their vaccination status? To look at the hospitalization rate and mortality rate between different variants among this group. And what they found is when you did an unadjusted analysis, right, you didn't adjust for those covariates like vaccination and underlying comorbidities, then indeed your hospitalization rates and mortality rates for Omicron were significantly lower than what we saw in previous waves. So Omicron is used as a reference point. So those odds ratios are how much above Omicron these other variants were. And you can see that a 25-ish% roughly, it's an odds ratio, so it's not quite that, but you can see about 25% increase in the odds of ending up in the hospital, or the odds of dying were actually a little greater, 40 to 80% higher odds when you're looking at it compared to Omicron unadjusted. But when you adjust for those other factors, you adjust for underlying comorbidity, you adjust for vaccination status, you can see that these things are exactly the same, essentially. So what that means is the differences we're seeing in outcomes with Omicron, and I would say BA2 and subsequent variants as well, are not necessarily related to the viruses being more mild themselves. It's just the fact that our population is much more protected. We have higher rates of vaccination, and that's what's making the difference. And that indicates that in areas where we have lower vaccination rates, and particularly lower boosting rates, again, we're not going to see that significant divergence from previous hospitalization rates and fatality rates, and the decoupling effect that we've seen in many other places, including Europe. So again, just more warning for us about what's potentially coming with new variants, which are, we know, much more transmissible. So we're going to get a lot more cases. And in people who aren't well protected with vaccine or recent infection, they are likely going to see outcomes just as bad as they've seen previously. And this means that, again, come summer, if we're going to see a significant wave of BA.212.1 or BA.4.5 or one of the new variants here, if the coin flip goes in the wrong direction for us, then we'll see this morbidity and mortality in the summer. If not, we are certainly going to see it in the fall. And so that's, I think, what we need to be thinking about here when we're moving into to the end of the school year and starting to make preparations for the beginning of next school year.